During this presentation, I will be discussing autism spectrum disorder. Autism spectrum disorder, which is sometimes also referred to as ASD, and is most typically seen in males, affects approximately 1 in 68 children in North America. This is an outstanding number. Despite there being many stereotypes that surround a diagnosis of autism, these children can grow into functioning adults with the help of early intervention through several therapies. ASD is a mental health disorder that can be characterized by several things. These include, but are not limited to, difficulties with social interaction, communication, and repetitive behaviors. Most children with ASD do not look different from their peers, as the symptoms tend to be more closely related to the way that a child behaves. These symptoms include avoiding eye contact with peers and elders, no grasp of feelings or emotion in other people, delayed speech and communication, trouble with transition, flapping of the arms or rocking of the body, and unusual reactions to normal situations. This is a diagram that shows the social, behavioral, and communication symptoms of autism spectrum disorder. The red and orange areas show the more serious symptoms, while the blue areas show the milder symptoms. Autism spectrum disorder includes a diagnosis of autistic disorder, pervasive developmental disorder not otherwise specified, as well as Asperger's syndrome. ASD is generally present from early childhood and continues through the rest of an individual's life. Children that are diagnosed with ASD do not all display the same symptoms, and their qualities of life may differ. Generally speaking, there are people with high-functioning ASD, and there are people with low-functioning ASD. People that have high-functioning ASD, which usually means a diagnosis of Asperger's syndrome, have fairly good communication in comparison to the lower-functioning versions of the disorder. They have very high intelligence. They have the desire to interact with their peers, but they usually do not have the social skills to do so. They have awkward behavior, and they have trouble differentiating between tone. People with low-functioning ASD are unaware of the world surrounding them. They often display self-injury, injury to others, odd rituals, and they sometimes have epilepsy as well. There are a wide variety of extensive behavioral therapies that can benefit the development of children who fall into the autism spectrum. One of these therapies is speech therapy. The goal of speech therapy is to improve comprehension, expression, pronunciation, as well as sound production. Occupational therapy focuses on the goal of helping individuals achieve independence in all facets of life. ABA therapy is specific to ASD and focuses on the child's individual needs. For example, one child might have exceptional difficulties with speech, while another child might use this therapy to focus on learning how to focus on one task at a time. This is a picture of a communication board that is used in ABA therapy for both high-functioning and low-functioning individuals. This board helps to improve the communication level as well as the wants and needs of the child. This board is often used by an elder, such as a teacher or a parent, to communicate to a child what is being expected of them. An example is, first you must do math, then you can have recess. Usually, a demand is followed by a reward in order to keep the child's attention. This picture shows a couple of examples of demands and reward pictures that you might see on the previous board. Regardless of the difficulties that these children will face, they are often able to grow into functioning adults with the help of early intervention through several of the therapies that I have previously talked about. We often assume that being diagnosed with autism also means being diagnosed with mental retardation among other impairments. This, however, is not the case. Therapy will always benefit and improve the quality of life for children with ASD. Thank you for listening to my presentation.